something's wrong with me and no one's listening. I have pneumonia. They tell me I have pneumonia. I'm not okay and I need your help. He did a chest x-ray. He ran back into the room. He threw my x-rays up and he looked at my husband with tears in his eyes and he said, I don't have time to call an ambulance for her. You have to get her to the hospital. She won't make it.
Welcome to the Doc Moliver podcast, plastic surgery, science, and cool stuff in between. I'm very happy and excited to interview Nikki Ivey. Nikki is a Ziglar Legacy Certified speaker and trainer, a published author, radio talk show host, and entrepreneur. Nikki has overcome many challenges and recently was on life support and in a coma. She wants to educate and bring awareness to others about her experience. Nikki, thanks for being here on my podcast. As you know, this is mostly about plastic surgeons, but it's organic, it's developing. I found your story so compelling and so interesting that I absolutely wanted to have you on the show. There's a lot of really great interest and research about BII, and there's a lot of really fantastic scientists within the plastic surgery community that are doing some really in-depth, fantastic research. I'll tell you that while they're not finding a whole lot, they are finding some things, and they have to do with chronic inflammation markers.
Absolutely.
So I think that's where it's all going to wind up. As I told you, it's going to wind up about having foreign bodies and biofilm and that kind of stuff. They're not finding the big red flags, but they're finding some very interesting things. Tell me about yourself.
Well, I have a whole story about how everything came to be, and there's a lot of things that I kind of want to point out just to bring awareness to people. My story coming out and telling people what has happened to me might give someone some ideas. I know I certainly had some influence into checking out, could it be my implants? And I want to, before I even start, I want to tell you, thank you for taking me as a patient. I'm going to get into that in a little bit, but I cannot thank you enough for trusting me, allowing me to be your patient. I had a really hard time getting a doctor, and I couldn't be more happy with the way that you treated me, the way that you heard me. You were the only doctor that even listened to me and didn't completely write me off. I really felt heard for the first time. And when you told me that you would do my surgery, I don't think you remember this, but I was in a room on FaceTime with you because I live so far away.
Where did you live at that time? Where do you live now?
I still live in Odessa, Texas.
Oh,
yeah.
You are in Odessa. And I remember that conversation and all about that.
I just started bawling because I was so thankful that someone actually heard me, because I was treated like I was absolutely crazy.
A little segue here, and it's not to toot my horn at all, but a lot of plastic surgeons these days are just trained in plastic surgery. That's not to diminish what they do, because they typically train for about 6 years and they rotate through general surgery and they rotate through all the different specialties and then do a ton of plastic surgery.
Right.
But when they come across a case that might wander into a bit more than they're used to, they tend to not want to do it. And a lot of us are operating out of surgery centers and they just get a little concerned. My general surgery training and operating out of my own facility for over 25 years with really great personnel and the same personnel all the time perhaps gives me a little more confidence. And really what you had going on, I just didn't feel, I personally didn't feel like it should be a contraindication to going ahead. So that's my take on that. So maybe I'm downplaying it a little bit, but I remember you telling me.
I felt the same way, but I couldn't get anybody to, I know. I was like, please, somebody, anybody,
well, we have rules about different things about who qualifies for surgery and who doesn't, but you have to take into perspective what you're doing. If we're doing a body lift and there's a lot of fluid being moved back and forth, that's one thing, but not in your cases. Again, not to diminish it, but you've gone through a lot of.
I've gone through it. And so I want to really talk about this because there's some interesting points that I want to make about several different areas of this. And so I would
Go
like to
ahead.
start with why in the world would I ever be interested in doing breast implants in the first place? So I'm a natural sort of person. Um, I I I don't like putting chemicals in my hair. I don't like, I put coconut oil on for lotion and all of those things. So for me to have gotten implants in the first place was a big deal. So it started because people had shamed me. I worked out at a gym. I became a trainer at a gym. All the girls were going and getting breast implants. I wouldn't do it because I didn't want, to put foreign substance in my body. Okay.
And you're more holistic.
I'm very holistic, very. And so
When was that? Let's add some dates in
let's
here.
talk. Yeah, that was probably 2015. 2015 probably.
And you were a trainer.
Yes, yes. I was a Zumba instructor and went to all kinds of um, workout things at a gym and hung out with gym girls who all went to this plastic surgeon and all got the same implants put in, and I wouldn't do it. And so fast forward a little while, I kind of watched what they went through. I saw that they were still okay. And then would you believe I ended up finding a lump in my breast and freaked me out. And then my holistic self started looking at, well, there has to be a reason why. So I started researching bras and the lymphatic system and what happens whenever we don't allow our breasts to move freely, if you will.
Hmm.
So I called one of my friends from the gym. I said, can I come over? I need to talk to you. And I said, I would like to go to your plastic surgeon and talk to them, and maybe we could do some kind of surgery where I don't need to wear a bra because I have this lump that I could feel. And so I ended up going to meet with him. Of course, instead of him doing like a reconstruction or a lift, he obviously said an implant would be so much better. And then my question was, would I need to wear a bra? And of course, he said, absolutely not. And so that was going to be my route to being, not not so restricted so my lymphatic system could drain the way it needed to drain.
Okay.
So I know it sounds so silly now. In hindsight, it's so silly. But then whenever I got my implants, I remember going and right after my surgery, I just did not feel good. I did not feel good at all. I don't know anybody that feels great after surgery. I know one time I felt great after surgery, but we'll get to that in a minute. But I had body aches. I couldn't get warm. I had brain fog, panic attacks. And then it got to where I thought, well, this is just from the surgery, so it'll chill out. It'll chill out. It'll be better.
How soon after you had your implants in did you start having those symptoms?
Right away, right away. And it got to the place, Dr. Molivar, that I actually was crazy. And I know that sounds nuts, but I would go to a friend of mine's work and I would just sit in his office and I would just be like, something's wrong with me. And I would just sit there and cry. And I had brain fog. You're talking to someone who was a motivational speaker and busy all the time, never had one job, never had one gig. I mean, I was doing door-to-door sales at the time also. I went from being that person to I can't even get out of bed. I'm tired all the time. My body hurts all the time. And so I'm going to doctors and I'm telling the doctors, oh, my hair's falling out and my face is puffy and I'm starting to gain all this weight. And I'm a holistic person, so I eat clean, I exercise, I did everything. And if one little thing was wrong, I got to the bottom of it. So I started going to doctors, getting tested for everything. And would you believe that I was on the indicator of lupus and RA plus chronic inflammation?
You had all
Yeah.
kinds of markers
Yes,
popping up for all of this.
absolutely.
You went to a rheumatologist, You went to, did you go to an immunologist?
I did. And it started with my primary care physician, of course. And then whenever those indicators came back, certainly they sent me to a specialist in each area. And everyone was telling me I had all of these autoimmune diseases. And I said, I don't have autoimmune diseases. You can't tell me that I do. Right. But they're like, well, your blood work says.
Exactly.
So,
I mean, you can't ignore that.
You can't ignore. You
And
can't.
women get these diseases a lot more than men.
Absolutely.
And so that's what we're trained for. And that's still the party line is.
It is.
Women get these things, and
yes.
we don't really want to jump to conclusions that, oh my gosh, it's your implants for sure. Let's just take those out.
That wasn't even on my radar.
No, and it shouldn't be. I think you went about it the correct way. We try to rule out. We have a saying in medicine that common things happen commonly. So rheumatoid arthritis, unfortunately, and lupus, unfortunately, happen pretty commonly, and there's hundreds of thousands of millions of women out there with breast implants that are absolutely fine.
Sure.
But there's some that aren't.
Yep. And it wasn't even on my radar. I didn't even for 1 second think it could be my breast implants. Not for 1 second. I started having breathing problems.
Mm-hmm.
I started having constant drainage, constant mucus, I still have kind of the nagging cough, but it's so much better. We'll talk about that in a little bit. And then my body hurt all the time. And I got really sick and I went to the doctor and the doctor gave me a steroid shot. And I went to my chiropractor's office, who's also one of my best friends. And I said, I know what's wrong with me. And he said, what is it? And I said, I have chronic inflammation because I feel amazing on these steroid shots because my body doesn't hurt. And I have energy and I have all of these things. The problem is I can't stay on steroids. So what can we do? So I went to anti-inflammatory diets. It would work for a minute. I went completely vegan for 2 years, 2.5 years. And then
I was vegan for 3 years.
Yep.
We could talk about that another time. Anyway, go ahead.
So by 2019, 2020, I was
4 or 5 years of this stuff.
Yes, I was completely unrecognizable, super heavy.
How much did you gain?
100 pounds.
Oh my goodness.
I know. And
my goodness.
And everyone that knows me, that's around me all the time, was just like, what are you doing? And I'm humiliated because I'm a public figure. I pride myself on taking the best care of my health possible and being the top notch and being the example. And there was nothing I could do. There was not a diet, being vegan, exercising. I constantly had stress. I was a nut, an absolute nut, crazy pants.
Okay. And what that does to your self-esteem. Oh my gosh.
Oh my gosh. It just tore me apart. I stopped speaking. I stopped traveling. I stopped doing my radio show. I was in deep depression. My hair was falling out. So in the summer of 2021, I just didn't feel good. And I kept going to people and telling them I don't feel good. Finally, they did a chest x-ray. I had pneumonia. This was from constant nasal drip. I don't have to tell you anything for the people that don't understand what happens. Your body cannot handle coughing. It is very aggressive to the body. So when you cough, you are wearing your body out. When you have nasal drip, the nasal drip keeps going, turns into bronchitis. And then bronchitis untreated turns into pneumonia. And it's just a slippery slope. Now I'm heavy. And so I wasn't sure if I couldn't breathe because I was heavy or if I was having lung issues. So I kept going to ERs, to urgent cares, to primary care physicians. Help me, something's wrong. Thank goodness I called a local urgent care and asked if a doctor named Matthew Sanchez was there. and I asked his permission to talk about him. And he had seen me before at a local clinic. And I went in and I said, Matthew, help me. Something's wrong with me and no one's listening. I have pneumonia. They tell me I have pneumonia. I'm not okay and I need your help. He did a chest x-ray. He ran back into the room. He threw my x-rays up and he looked at my husband with tears in his eyes and he said, I don't have time to call an ambulance for her. You have to get her to the hospital. I'm going to call them and tell them she's on the way. But I don't have time to call 911. She won't make it. So
Wow.
we go and get in the truck and I say, move over, buddy. You drive like my grandpa, real slow and steady. And off we go to the ER. And I go in and he goes and parks the truck. And by the time he gets back in there, they're telling me, they're asking me, the doctor comes in and asks me, do you believe in God? And I said, well,
Oh my gosh.
yeah, of course I believe in God. And he said, well, I just want you to know that you're going to have a lot of peace where you're going. And I said, I'm not going anywhere. Like, I'm not going anywhere.
How old are you at that point?
Oh my gosh, I'm 41,
No,
41
no,
years
not
old.
now. Not now,
Oh,
then.
no, that's how old I was then. Yeah.
Yeah.
So, and we need you to make some decisions. We're going to give you 3 minutes. We need to know, do you want people to call your room? We're going to have to ventilate you. It got so bad that whenever he said, we're going to ventilate you, my response was, yes, let's go. I can't breathe. I need air. That's how excited I was. Had total peace. He told me I was going to have a lot of peace where I was going. And I said, I'm not going anywhere. And he said, we're going to have to put you on a ventilator. I need you to call. You've got 3 minutes to call who you need to call. And then I need these papers signed. It was very quick. And then before you know it, um, unbeknownst to me, because I'm ventilated and in a medically induced coma, when I do wake up several weeks later, um, I can't talk. I don't know where I'm at. I don't know anything that's going on. When I do start talking, I remember asking my husband if I had to have a breathing machine, and he said, yes, you had to have two. And he said, the ventilator didn't work, and they had to do a tracheotomy on you. So I have a huge hole in my neck from a tracheotomy, and I still had the trach in my neck at that time. Um, a lot of people don't know this, but they think whenever you wake up from a coma, whenever you've been on life support for a long time, that you're like Grandpa Joe and Willy Wonka in the Chocolate Factory. You just hop out of bed and you can suddenly walk. Um, you have to remember, I'm heavy. I was heavy in a coma.
People don't realize that
They,
when you gain a lot of weight, you actually gain a lot of strength.
Mhm.
Imagine taking 100-pound bag of whatever cement
Sure.
and carrying it around 24/7. I mean, you can't carry that for 5 minutes, 3 minutes, an average person.
No.
So when a person's overweight to that extent, they get very, very strong.
Yeah.
Put them to bed for a couple of days, let alone a couple of weeks, and they cannot hold their weight. They can't get up,
No.
and usually they're carrying another 20 pounds of fluid because they're all
Sure.
inflamed, and they literally can't get out of bed.
Yeah.
They have to build up their strength, and
Sure.
you probably went through a bunch of rehab, and they don't know what the heck happened to them either.
You can't hold. They tried to hand me my phone. I couldn't hold it. They wanted me to write something. I couldn't hold a pen to write. It took me 6 months to learn how to write again. It took me. I still fall, and it's been 2 years. I still have to have help getting dressed. This is my first public appearance since I was in a coma, because I
Now,
have
right now.
this second is my first
Oh my
appearance since
god.
then.
Oh my
Yes.
gosh.
Yeah, because I can't even dress myself, much less go on a stage and speak and train. And are you kidding me? Just the road to recovery. So now let's fast forward. So it's been a long road. Yes, yes, yes. And then I was watching Emily Simpson on one of the real housewives shows. It's one of my guilty pleasures. And she was talking about getting her breast implants removed. And
Hmm.
then I thought, well, that's interesting. So I reached out to her on social media and said, hi, you don't know me, but I'm having all these issues. Can you tell me a little bit about your journey? And she, she said a lot about what you and I talk about. She said, I have so many friends that have never had issues with breast implants. But for me, it did X, Y, and Z, and I feel better since I got them out. And
And
then
she responded. She responded to you.
she
I mean,
did,
because
and
those people, they're celebrities. They get a
they are.
lot of people contacting them.
Yes.
Kudos to her.
She's a
A
wonderful
lot of people
person.
don't do that.
She actually walked me through a lot of things. She told me exactly what procedure to ask for. She said, make sure you get this certain, the capsular constructure, get the whole capsule out. I mean, I would have never known to ask
And there's
that.
and that, and a lot of people talk about that. And I'm going to
Sure.
talk about it a little bit with you.
Okay.
And there's not a lot of good science about that,
Okay.
and people talk about it a lot. I have my own feelings about it, but
Sure.
there's a lot of misinformation out there, and people are religious about it. You have
Sure.
to have it. We just don't know if it's just it just kicks off an autoimmune
Right.
disease, if it's a chronic inflammatory thing from a biofilm. But
Right.
regardless, she at least was listening to you and
She
guiding
was, and
you
she was
and
so
helping you,
helpful. And then
and
I
that's a lot.
remember it's huge because she didn't have to. And she even was going to hook me up with her plastic surgeon if I wanted to go out to where she was. And so
Hmm.
she was absolutely wonderful and totally genuine. And then I remember a good friend of mine from a long time ago, Jennifer Moran,
Hmm.
had also talked about it.
Yeah.
And so I watched this documentary called Explant, and it really was an eye opener for me. And then I reached out to Jennifer Moran and I said, Jennifer, I've got a problem. All of these things are going on. I don't remember exactly what was being said, but paraphrasing, I said, I know you've talked about this before. I know that you also got an explant. You've been very vocal about it, trying to help people and bring awareness because some people are struggling with this. This
They
might
are.
this might be the culprit of my chronic illness. Jennifer, you wouldn't believe what I've been through. And so she hooked me up with you. And whenever I made an appointment with you, as me being 10 hours away from you, were so kind and did a video consultation with me. I told you all of the stuff that I'd been through, and I said, Dr. Molivar, the truth of the matter is, no one is wanting to do this surgery for me because I'm heavy as a horse. I have been on life support and in a coma, by the way. I had a ventilator and a tracheotomy, and people are just panicked. But I said, Dr. Molivar, I'm healthy. I'm so healthy. I eat good. I I can prove it to you. So you had me do a few things. You had me do a mammogram to make sure I didn't have, and then you had me do some blood work for you. And whenever you saw on your end that I was healthy, minus being super heavy and major inflamed and
Oh yeah. Oh yeah.
all of that stuff, you without
Sure.
a doubt said I don't see a problem. And I said, I can handle anesthesia for a couple of hours. I was in anesthesia for weeks. And I pulled out
That's
just
true.
fine.
That's true.
So,
And you didn't have active and a very virulent and aggressive pneumonia when you were going to come in. You were clear from
no,
that,
I
and
was cleared. Yeah.
that's a big deal
Yes.
there.
Yeah.
And this was now remind me because I didn't review your notes before tonight. I wanted it
Yeah.
all to be very authentic. What year was this when you were most sick and you had your
It was 2021.
tracheotomy?
I think it was
Yeah,
2021.
and it wasn't COVID pneumonia, was it?
No, no.
Yeah.
And they thank goodness we had COVID going on because they knew exactly what to do.
Right, right.
And
They learned a lot during
they learned a
COVID
lot.
on how to ventilate people.
They do, and they do
You
it
know,
regularly for breathing issues and to give people's bodies rest and all that stuff. And so, fast forward to when I come to get the surgery done, I meet with you and your wonderful staff. Treated me like family, didn't treat me like some leper, which is how a lot of people treat someone who has been in a coma with a hole in their neck, and
People get scared. They don't know
they
quite
get
what to say.
terrified. They don't know what to say. They don't know how to
Yeah,
do
yeah.
anything. It's okay. I
Well, my
completely
staff's been with me for a long
They're
time. My
so
nurse has been with
wonderful.
me almost 20 years, and
Hmm.
my office manager 25 years. So
Yeah. The
we've done a
best
lot of work
people.
together.
Absolutely the
Thank
best
you,
people.
thank you. They
Um,
are sweet.
I have referred so many people to you. I'm on all of these groups, raising awareness, telling everybody that you're the guy to go to. And with all the trauma, and I still have tons of trauma from being in a coma, as you can imagine, going into the surgery room at your office and laying on that table, I felt no anxiety whatsoever. And if I go to a doctor now, or I've had to go to the hospital where I was in a coma, um, I just panic.
You probably have
Yeah,
PTSD from all that.
totally in counseling. I'm in counseling. Yeah, it's a nightmare. Had no issues whatsoever. And I tell you what, I took pictures of my face the morning before my explant surgery, and my whole face was just so swollen, eyes bloodshot red. And when I woke up from that surgery, the first thing I did was take a huge breath, because since the day I got breast implants put into my body, I had not been able to take a deep breath. So that was huge for me, especially had been fighting to breathe for so long, right? And
Hmm.
then after we left, against doctor's orders, I felt so good that we actually went to I think it's a 3-story Dillard's there, right around the corner from your office. And
There's a mall about
yeah,
2 miles away.
yeah.
Yeah,
And we went and did a little light shopping, and then went and got something to eat. But I didn't feel like I'd had surgery at all. It was nothing like getting them put in. And
yeah.
I went to bed
Well,
that night.
typically, that's interesting, and we might just
Yes.
talk about that for a moment.
Mm-hmm.
I don't know, maybe 80% or so of breast augmentations or augmentations with lifts, surgeons put the implants under the muscle, and that
Mm-hmm.
hurts. That's very, very
Yeah.
uncomfortable.
Mm-hmm.
Explants don't hurt like that. And
No.
then I would say the other thing is that was already 21. That was already when I had started my new regimen of what's called the ERAS protocol. So we weren't even using narcotics. So you probably had the newer protocol, which
Mm-hmm.
you're not all drugged up with
No.
the opioids because we don't use them anymore in my office,
No.
in my surgery center. So it's a better feeling, but mostly explants just don't hurt like the
They do
augmentations do.
not.
Yeah,
And
yeah.
and
So you
I
shouldn't be afraid of them.
not at all. And I
Yeah,
venture to say I felt better right after surgery than I did the day before. And
yeah.
I have this
I hear that a
picture of
lot.
me holding the implants and smiling from ear to ear. I have a picture of me shopping afterwards. I mean, I just had a new lease on life.
Yeah, I'm glad you didn't tell me about this.
Yeah. We didn't do a
I've had patients that feel so good after their tummy
yeah.
tucks, which they shouldn't be. I mean, I want them up and walking around, but sometimes people are a little too aggressive. But
Yeah,
with this kind of
I didn't
operation,
go too nuts. Yeah,
but
I
you're
certainly
not going to get
didn't.
in trouble. You're not going to get in
Yeah.
trouble. Just a little bit of walking around. It's actually good for you. Yeah. So then you drove. Then you
I
stayed a little
stayed
bit.
the
You
night,
stayed. Yeah.
yes,
Yeah.
and I came to see you the next day, and
Yeah.
we were, I mean, just ecstatic. I was terrified. Not really, but I say I was terrified. I was a little concerned about what everything was going to look like, but after almost losing my life, that is the least thing that you care about. You want your
Right.
health. You
Sure.
absolutely want your health. And then hindsight, thinking back to the days where I was made fun of and all of those things, who cares? Who
Oh, that's so
cares?
sad.
Isn't that
That's so
sad?
sad. It
And
is.
so just let's be happy with who we are. And if it's something we
Sure.
want to do for us, then let's do it. But definitely not ever give into peer pressure about what someone thinks about you. I mean, the girls at the gym would just give me such a hard time and make so much fun of me because I wouldn't go get implants like they did. I was
Hmm.
happy with who I was.
How tall are you?
5'9".
And you're a taller gal, you're a bigger gal.
Yep.
How much when in your leanest days when you were a trainer and you were working out all the time, how much did you weigh then?
my best is right at 200 pounds.
Okay.
Yeah, I'm a smoke show at 200 pounds.
Okay. You're
Yeah.
you're 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 just a tall gal.
Yep,
Yeah.
I'm just a big girl, and
Yeah.
I've always prided myself in being a big girl and just super, just lean and strong and representing. I wish I was 6 foot tall. That's just that's a sign of beauty to me, and curves are beauty to me. So, 190, 200 is just absolutely perfect.
And what was your max weight through this whole process?
My max weight, I think I got up to 310.
Okay.
Mm-hmm.
Yeah.
And still no one would ever believe 310. Um, and but man, do you feel it?
Oh
You
yeah.
feel it. You really do. So,
Yeah.
mm-hmm.
Carrying a lot of weight out there.
Yeah. And it's
Yeah.
not healthy.
It's
It
no,
wears
it's
your
not
body
healthy.
out. You
It
can't
does.
you can't
And,
recover.
and once you get on that downward curve, you're
Yep.
weaker and you're weaker and
And
you
let
can't
me
carry it. Yeah.
You can't. And then
And then
I
if you're
didn't
sick,
get physical therapy.
you didn't.
After, no, I got 3 days and then I had to go back to work. Because bills were due and I had to go back to work. And I went back to work in a wheelchair with a gauze over my neck because I had an open hole. I couldn't sit up, I couldn't hold a pen, and I drooled. And, you know, I had to have someone help me to the restroom because obviously I couldn't get in there myself. It stayed like that for many months. With that, on top of the weight and and chronic inflammation and just feeling, it's been such a battle until I got my implants out. And I tell you, since the day I got my implants out, slowly but surely, my hair is thicker than it's ever been, ever. It's short because I lost 90% of it in that coma. And so I've had to cut it and stuff. It used to be super long, but it's thicker now than it's ever been. Brain fog has gone away. I have no pain in my body. I do have a little bit of a cough, but that's because I live in West Texas and it was 88 degrees on Monday and it's 40 today because of all the wind. So I do have some allergy stuff going on. Nothing. And here's the most interesting part, Dr. Molivar. When I went back to that doctor and those other doctors to get my blood work done, to get those indicators checked again, negative for chronic inflammation, negative for rheumatoid arthritis, negative for lupus.
How
That's
about that?
huge. That's
How
huge.
about that?
Not even on it. It's been such a journey.
And I'm not a rheumatologist, but some symptoms do come and go. And so people come in and they say, "Oh, I have this and I have that." And I joke sometimes. I say, "Well, maybe I should have my implants out because I have some of that too."
Mm-hmm.
But joking aside, some of those symptoms kind of come and go. But for
Sure.
the actual chemical markers for lupus and the actual chemical markers for rheumatoid arthritis to just go away,
Yes.
that's really on. You got to look for something like, how did this happen? Did you get on a whole
Exactly.
bunch of drugs that suppressed your immune system to make them not apparent, or what? And you were on steroids for a very short time, but clearly that wasn't it. And another part of this podcast, I'm going to present these papers that talk about some findings and some really good studies but these two women are just brilliant in our
Mm-hmm.
society, and the studies they did, and it's to try and elucidate, to tease out what is going on, and it's we don't know. It's definitely some
Yeah.
inflammatory markers showing up, but women get better, and I'll tell you in my own experience, I have women who have them out, and they say, and everyone who has them out feels better immediately. I've had a few of them who have come back, after a year and said, "Well, I'm kind of back where I was," but the vast majority of them really are better 6 months and a year. I have seen women come in and say, I remember several who had swollen joints, wrists, knees, and they've said they've been checked out every which way. They've been studied, and we take their implants out, and literally it goes away in a week. I had one lady who had a big rash across her neck. She had it for 3 years. She had biopsies. She had MRI. She had all kinds of skin tests, dermatologist galore. it was the weirdest thing. I mean, to see something like this with my own eyes, and I've seen it several times. We took her implants out. I don't remember whether she had a capsulectomy or not. I don't 100% do capsulectomies. There's no indication. We don't really find an indication for it. Though when they're thickened at all, I want them out because I feel there's a biofilm involved, an inflammatory area. And I think they resolve faster if you get that thickened area out. There's always a thin area. That's just normal protein that forms around these implants. But this lady in particular, 2 days later, her rash was gone. She said, "Oh my God, I've had it for 3 years." So, some things are coincidence, but I've seen these things resolve in days, in a week. So
Absolutely.
I mean, you do see it. I'm still waiting for all the science to come in to show us exactly where we're going with all this, but I see it. You were about to say some other things.
Just educating yourself. And I mean, I'm a believer. I prayed about it a lot. I was begging for answers. Please tell me, which way to go, what to do. And now I'm still just kind of fighting for better health, getting back in shape, doing all those things, and just regaining my health so that I can get back into the platform. And I'm not going to wait until I'm 100% there because I want people to take the journey with me.
Sure.
I've always talked about overcoming obstacles, and I had obstacles before all of this, which is why I became a motivational speaker and a radio show host, and I published a book, and I always had a heart to help other people. I have not handled all of this gracefully, but I have not. I have not been the motivational speaker. We can do all things at all times. It's been
No.
very difficult. But I'm up and I'm coming again as I go through things and I continue to heal and I continue to get better because it's such a journey. If you think you're going to get your implants taken out and you're just all of a sudden, everything's going to be great after what I've been through, you're setting yourself up for a failure and you have a false mindset. The fact of the matter is I didn't get physical therapy. After all of that, I needed physical therapy. I still need to work on fine motor skills, and my husband still dresses me every day. And
You're
so,
kidding.
no. And it's so interesting the things that you get right back, the things that have taken a long time. And you can't pick and choose. And
I
so
can't even imagine how much courage just to come on the show and just
yeah,
to show yourself and tell
it's
your
hard.
story.
It's hard because I don't look anything like I did before I got implants put into my body. In
Yeah.
fact, I see people all the time that don't even look at me, don't even recognize me, and I don't even dare talk to them or, "Hey, how are you doing?" because I've been embarrassed. And I don't want to, and I'm not going to be that anymore. I'm going to say, "Here I am. This is what I've been through. Um,
Good for you.
yeah, here I am. This is what I've been through. Judge me if you want." Everyone always gives me diet advice and weight advice and all this stuff,
Right.
and
Everyone's out there with that.
it's just the way it is. But
Well, God bless you. God bless you for taking the bull by the horns, for coming out,
yeah,
for owning it.
yeah, I own it. I own it, and this is my struggle. This is what I've been through, and I haven't done everything perfectly. But no matter how long you're down, no matter how bad you're out, no matter how embarrassing it becomes, and you can always recreate yourself. You can always come back. You can always be, and let me tell you, the coma was the best thing that ever happened to me. It gave me clarity about life.
Uh-huh.
It gave me, I don't even want to talk to you about what I went through during the coma and what kind of clarity and blessings came with that, even though it was very traumatic and there's a horrible side to it. But you also see who's there for you. You see what the world is made of, and it's not as pretty as people think it is. I don't have a story of rainbows and sunshines about this. When you're sick like that and you come out of something, people are not lined up at the door to help. I mean,
Your husband's still there.
oh my gosh, my husband, he's the biggest point on my notes that I took to make sure that I talked about my husband because he's the main point of the story. You think I've had it tough through all of this?
I can't
Oh,
even.
the brunt. He had no idea what ventilator meant. He thought they were giving me a breathing treatment. They let him go in the room when they ventilated me. And they all just walked out to go help another patient, and he's standing there with me being ventilated. The trauma that he had to make the call whether to do the tracheotomy or not. Here's the stats they gave him. Mr. Ivey, she has a 5% chance of living. Do you want to just go ahead and let her go, or do you want to try this tracheotomy? Now, the tracheotomy is a very risky procedure at this point.
With a girl your size, it was at that point.
Yes, and I've been in
Yes.
there for a while. We can either let her go now, or we can do this tracheotomy. But I'm telling you, there's a very slim chance that the tracheotomy is going to do any good. There's a very slim chance she will make it through the surgery of putting the tracheotomy in. He had to make the decision, and he did. He would come into the room and would just sing praise and worship songs at the top of his lungs. And when the doctors would come in and say, it's not looking good, this is not working good, this is not gonna, if she does live, she will never walk, talk, she's gonna have major damage, she could be a vegetable forever. And he would just say, let me pray with you. And he would just say, Father, thank you that my wife is healed. Thank you that this doctor has the wisdom. And he would not accept it. So when I was down, he was in. And so he never gave up. He's dealt with my bad moods. What's funny is they called him in the middle of the night when I was still in a coma. And so he answers the phone and he says, hello. And they say, Mr. Ivey, we need to talk to you about your wife. And he said, okay, go ahead. Well, she woke up and she tried to pull out her trach and her vent and everything else. And we had to resedate her and tie her to the bed. And so that was the victory of it all. And so definitely my rock, definitely you have to choose your partner very carefully. He's been
Amazing.
through it.
A lot of men bolt.
They do.
A
And the
lot
sad
of
thing,
men bolt.
they told him up there, because this was during COVID when there were so many, they told him when he was up there, you're the only person that comes and sees, she's the only person that gets a visitor every day, twice a day.
That's really
Yeah.
good.
Yep.
And he had to go to work. He had to take care of things.
Oh yeah, he had to do everything. He still does everything. And so he's definitely had it harder than I have. Because he's had to sit back and watch this person who was positive and all of these things lose their health and their mental. I mean, I have not been mentally stable through all of the things. So for him to be that rock, and then just having the courage in me and the patience and the grace to know who I really am and that I'd be back there someday, but better.
God bless him. Thank you for
Wonderful.
sharing that. I used to do a lot of breast reconstruction years ago, and there's a lot more sophisticated techniques now. I dabbled in it for a very short time. It's sort of the end of my reconstructive breast reconstructive career, which was about 10 years. But I also moderated a breast cancer support group, and it's different. But I hear a lot of the same things as what you're talking about. It's very different, but it's because not to generalize, and not to say that all women should fall in a particular category, but the roles that women played in their households, in their relationships, there's a lot of commonality in those kinds of relationships between a spouse who's a husband. That's what you got to say it these days.
Yeah.
But a lot of guys are not supportive, or perhaps the marriage is not really strong to start with, and a lot of those guys were not there for their wives, and the wives really, they got a lot of, the word you used was clarity, and a lot of these women sort of figured out, it was like they talk about it in this book's been written about this. It was the best thing that happened to them in a weird sort of way, because they figured out what's important and what's not. And in many cases, this relationship was never worth it to start with. Obviously yours was, and thank God, and it's a blessing, and you're so fortunate, and what a wonderful man. I'm so happy for you and proud of what you've accomplished.
Thank you so much. And I mean, I've said it before in this podcast, but I just cannot thank you enough. I think you were number 9 or number 10
Wow.
plastic surgeons. Some wouldn't even meet with me.
It's true.
And I don't
You know,
blame
we
them
we
with,
we tell our staff,
no fault of their. Hmm.
what's their BMI? If their BMI is over this, I won't operate on them. But
Hmm.
you have to reconcile that. You have to moderate that. For example, there's a lot of Black women out there who are just heavier structured women, and
Right.
a BMI is just not fair to them sometimes. You know,
Hmm.
and you have to say, well, wait a second, back up a minute. What are we doing? What kind of surgery are we doing? How long are they going to be under?
Right.
You know, how in depth is it? Where are we operating? And if we're operating on breasts, or are we operating on a big tummy? And let's take a little bit closer look at them. And I think it's a fairer way to do it. I
Super
mean,
strength. I mean,
you're a 5'9", 200 pound, strong, big
yeah.
figured gal. You're a different gal than that 200 pound,
Yes.
5'4" gal who's, maybe really never exercised at all, never did
Sure.
anything, and that 200 pounds is really big,
And
as opposed to a really solid woman. So it's different bodies.
you put me next to another person that weighed 200 pounds, I look my best at that at 200 pounds. I mean, that's my favorite way that I love myself is 200.
Right.
If I get any less, I mean, throw a steak my way, please. But it makes you very, very,
The heck with that vegan stuff.
the heck with the vegan. Give me the steak, medium rare.
I have to tell you, I read a book called The China Study, and
You were telling me about that.
it's a fascinating study. And the guy's he was a biochemist and a biologist, or up at Cornell. And the author, I'm blanking on the guy's name right now. Fascinating book. And I just took it to heart. And no dairy and no meat
Yes.
at all. And I did it for 3 years. And none of my friends really said anything until I woke up one morning and said to my wife, I think I need to eat a steak today. She
Yeah.
said, hallelujah. Because,
Yeah.
she's not a big meat eater, but she'd eat some here and there. But my body, my person, I was just
Hmm.
built to be more omnivorous. I've always liked salad and vegetables from the
Sure.
time I was a kid. Well, anyway, within a week, my friends, many of them said, I don't know what you're doing, but you look a lot better. You were looking terrible for a while.
Sure.
So, and that goes back to what you're going through. I think after all the studies I've read, I think there's a group or a subset of women out there who get breast implants, who develop a biofilm, because the breast,
Yes.
by the way, has its own biome. People don't know this, but when you
Hmm.
when you get into the research out there, the biology research, um, the breast is full of bacteria, and everyone's milieu, everyone's combination is a little bit different. And you have ducts in your nipple, bacteria off your skin crawl down there, kind of gross sounding. But just like your gut, the bacteria congregate on
Hmm.
our bodies, and it's different in our ears and in our eyes and in our gut and in our pharynx. And I think that while most people live in equilibrium, some get out of equilibrium. And then if you throw
Hmm.
a foreign body in there, some really have a hard time with it. And some bodies don't handle it well, while many
Right.
bodies handle it fine. And I think
Sure.
that's where the rubber meets the road. And it's sort of akin to what we were just talking about. Some people,
Absolutely.
just their bodies are different.
Yeah. And I've had to
So
do a cleanse. I mean, how long does medicine and how long would you think the medicine from my coma and being on life support, how long do you think that stuff stays in the body?
Well, I don't think the medicine stays in your body that long. I
You
really
don't
don't.
think
From
so?
my understanding and my belief system
Mm-hmm.
in terms of all of this, those antibiotics really mess with your bacterial equilibrium, right? And
Yes.
and all the stuff that we live in harmony with, that's
Mm-hmm.
totally normal. And when those things get out of whack, you get out of whack.
Yes.
I'm hopefully going to have another lady on my podcast who's a PhD biologist out of Baylor University here in Houston, who works on the gut biome. And the things they're finding out are mind blowing.
They say every disease comes from your gut bacteria.
A lot of them do.
Yeah.
They're finding out that dry eye is related to your gut flora.
Mm-hmm.
When you fix
Mm-hmm.
your gut flora, your dry eye goes away.
Yes.
I talked to neonatal intensive care units. A good friend of mine has been doing neonatal intensive care unit work for 30 years. She says they give all their babies probiotics, a certain type called BioGaia. You know, just straightening out your gut flora. You've heard of people with Crohn's disease and ulcerative colitis being cured with fecal transplant, where they take people that have a healthy gut and they process it a little bit, so you're not eating poop, but they capsulize it and they give it to other people, and it fixes their gut. This lady talks about some experiments they did with mice that had messed up guts, and their babies were totally wackadoodle. They're running all over the place, attacking each other. They're not caring for their little baby mice. When they fixed the gut flora in the baby mice, they all mellowed out. And I mean, they weren't giving them anything horrible. They all mellowed out. They grew up. They had babies. They were totally fine. The control group, who had messed up gut that they didn't treat with probiotics, wound up having babies that were just as messed up as they were. So
absolutely,
all from adjusting the gut flora. And I think, and I'm doing some research in this direction, that we're going to find out that we can look at the gut, at the biome, the microbiome of the breast, and perhaps we'll have some more information. They're looking at it in some of these studies. They're looking at it already, but I think there's a bit more to look at. And what I'm working on is how to take those specimens, because in many times we find out years later that it was all there all the time. We just didn't know how to test it. We didn't know how to take the biopsy, how to gather the sample. So there's more work to be done.
I have always struggled with gut issues. Always.
I've turned many people onto this, and it works. It's the reason why they like it up at Baylor, and my friends who are these biologists, is there's probably great probiotics out there.
Yes, but nobody knows what to take.
Well, two things I do know. We were in Bulgaria about a year ago, and there happens to be this Bulgaria probiotics and Bulgarian yogurt that's famous worldwide for the lactobacillus type of bacteria that it has. And apparently it's just super good for you. But you want to go the easy way, and I recommend it highly. I personally had some remarkable changes from it. But there's some really good science. They've done, with large numbers of people and good statisticians. Just go on Amazon and get BioGaia. We'll put a link to it below this podcast once we edit it. I think it's BioGaia. You pick it up on Amazon. You take one tablet or 2 tablets a day. It's a chewable, sort of citrusy flavored little pill. And I've got grandkids that have problems with eczema, and it flares. When their parents keep them on the BioGaia, their eczema is under control. When they stop taking it, their eczema flares up. I mean, it's just anecdotal. It's just this one case. It's not, a case of 1,000 kids with eczema, that kind of thing. But on an anecdotal basis, on a case-by-case basis, I had a plantar wart on the bottom of my foot for about 8 years. Could not get rid of it. I anesthetized my foot, hit it with my laser, tried to get it out. I've done that with patients. It all grew back. It all started again. I did all kinds of crazy things with it. Could not cure it. I started the probiotics, and 6 weeks later, not only were my eyes stopped itching, but my darn plantar wart that had been there for 6 years totally went away. So again, it's just a single case, but I keep on hearing this stuff. So
it's worth trying.
Where there's smoke, there's fire. I keep on hearing the same thing over and over again. You keep on hearing women saying, "Look, there's something going on," and I know so many people that get better. Yeah. So this is how we find out about things. You got to listen. When I was in medical school, they said, the most important thing you can do is just listen to your patients. They'll tell you what's wrong with them most of the time.
And you do such an excellent job of hearing us. And
that's kind of you to say.
And giving us a voice and letting us be heard. Even if you wouldn't have been able to take my case. Yeah. It was the first time a doctor ever listened to me and heard me. And I can't appreciate that enough. I cannot thank you enough for that.
You're
hopeless,
so kind.
Totally hopeless.
I think that's what we're supposed to be doing. We can't always help, but we can at the very least listen. Well, thanks for talking to
Thank
us,
you
and
for
thanks for
having me
talking to
on.
me.
And thanks for giving me
And
the opportunity to get back out here. And I couldn't be more excited to share the things that had happened to me. Hopefully, it helps some other people, and at least it'll start some conversations.
with your
Mhm.
permission, I would like to actually link below your contact information if anyone wants to
Absolutely.
reach out to you. Okay, great.
Sure.
That would be really
Yeah,
nice.
just put them to my Facebook, and
Uh-huh.
everything they need is right on there to get a hold of me. They can message me.
And we'll put a
Sure.
link to you,
Yep.
probably your Facebook page, and they can reach you there. Thanks so much for talking with us.
Okay, thank you.
Take care. I'm going to give a bit of a postscript now with some information about breast implant illness and where we are right now. It seems clear that everyone that is operated on for breast implant illness gets better. Everyone, which sort of drives the question, how is that even possible? From an academic point of view, from a scientific point of view, that shouldn't happen. So there's a lot of mixed feelings about what breast implant illness is. The papers I'll reference for you below were done by some really talented academicians, some talented plastic surgeons who have been writing about this for the past few years. And these papers and the research they did seem to show that there's no evidence of any toxicology, arsenic or heavy metals that are involved, which was thought for a while by certain conspiracy theory type of people and people who think they understood the science. There's no increased incidence of infectious DNA type of samples or processes going on that could be ascribed to an infection, at least overtly, because these DNA representations of previous bacteria or bacteria in the capsule seem to be present whether people are complaining or not. It just comes with the territory of implants being beneath breast tissue, that in a certain amount of cases you do see evidence of bacteria. Most, not all, but most of the inflammatory markers and very sophisticated inflammatory markers are negative, but a few are positive in all of the patients that complained of BII, or most of them. It's not really clear what's going on and why these patients are complaining, except from my point of view, I think it probably is true that it's an inflammatory process, and some people are more sensitive to it than others. Some of us are just built differently than others. Some people can't tolerate the taste of beets. It tastes like dirt. Some people can't taste certain things that other people can. Some people respond to certain medicines differently than other people. My feeling is it's probably an inflammatory process that some people don't react to very well. That said, it's clear that a lot of these inflammatory diseases, autoimmune diseases, happen in women a lot more than men. And if you feel like you have something going on, you should go to your primary care doctor or your internist and get these studies done. Make sure you don't have thyroid disease that you just developed on your own, and that oftentimes can be treated adequately, or some very regularly occurring autoimmune diseases that happen frequently. No one will blame you if you say, I still want them out. No one should blame you. I've seen swollen joints. I've seen rashes that have been present for a few years literally go away within 2 or 3 days of taking implants out. So I don't think all the answers are out there yet, but you shouldn't be afraid of coming in and being evaluated. And in my opinion, if you want your implants out, take them out. What is clear is that you don't always need a total capsulectomy. You don't always need an en bloc as a matter of course. I think, unfortunately, there's some people out there that will talk you into it and make you think that everyone has to have it, and that's the only way to do it. That's simply not true. I've taken many implants out under local anesthesia, saline implants, and patients feel better within days. So there's a lot we just don't know yet. That said, Nikki's story is amazing, and I'm glad she's on her road to recovery. Take care, everyone.
Thanks for visiting. See you next time.